My first cadaver is sponsored by Med School Tutors. Tin Man, what's the matter?
It's Valentine's Day and I've got no heart. We've been on this journey to stop the Wicked Witch, but all I can think about is that no one's waiting for me back home.
At least you have a brain. I spent months studying for step 1, but I can't figure out what these questions are asking.
Why don't you try Med School Tutors?
Who said that? Dorothy? Toto?
Down here, you straw schmuck. Their one-on-one tutoring will break down what isn't clicking for you. They'll make study schedules that chart a clearer path than the yellow brick road, and MST is always hiring tutors. If you crush your exam, they'll reward you better than the wizard himself.
I guess the Oompa Loompa really are famous for their wisdom.
I'm a munchkin, you burlap bigot.
Let Med School Tutors be part of your origin story. Together, we can save the world.
My first time?
My first big exam. My first surgery.
Oh yeah, that was crazy.
I didn't know if I would stay. My first intubation.
My first real patient.
My first lumbar puncture.
My first suture.
Oh, yeah, my first cadaver.
Did you play Operation as a kid? I remember the game being all about focus, control, and steady hands, not unlike actual surgery. However, this episode is not about Charlie horses, rubber bands, and butterflies. We're talking about open hearts and their many forms in real life. I'd like to do something a little different in our exploration of open hearts for this episode. It's my pleasure to introduce Miss Jacqueline Jackmond, who can speak from the patient's perspective of 2 open heart surgeries.
2 years ago, I had open heart surgery. It was to repair the pulmonary valve in my heart because I was born with tetralogy, a flow. I think growing up, I never talked about it. I just never wanted to admit I had anything wrong. And sometimes it was hard to hide because I have a big scar from the first surgery. It's certainly not a surgery I remember, but it was when I was a baby to first fix my heart. So there's this big scar on my chest, and then sometimes I'd have to go to the doctor and get a test, and this test would be like a Holter monitor test, and you have to carry around this big Walkman hooked to your chest with all these wires. So it's kind of hard to avoid that sometimes, and I kind of like hid away and pretended it was never there. But then when I came to New York about 4 years ago, I met a doctor, a female congenital heart doctor, and she was kind of the first one to really sit down and tell me about my heart because I never really cared to learn about it. I just knew something was wrong with that. I knew it was broken. And she was the one to kind of bring out a book and tell me the 4 findings, which pathology means 4, so there are 4 different defects. And at first, I could not remember anything that she said because it was all this anatomy stuff and the defects. And that kind of triggered me, though, to learn more about it, which I actually became very fascinated with. After having some tests, she said, I need to talk to you. I think it's that time that you start preparing to have open heart surgery. I was like, oh gosh, it just sounds awful. And I guess I have to do it. But it kind of happened at a rough time in my life because other things were kind of falling apart. Like my previous job was falling apart, and it was really not like in New York. So I was just like, oh my gosh, what am I going to do? So I met with the actual heart surgeon, and we had a discussion about what to expect, and I got to ask my questions. And it was interesting meeting him because I thought, this is the man who's going to be cutting me open and working on my heart, and I wonder what his life is about and what he's thinking, and I'm sure he does this all the time, so it's just like, I don't know, a snap for him. But it was definitely a big deal for me. So with tetralogy, one of the main defects is pulmonary stenosis, and that's a narrow pulmonary valve or a damaged valve, which was definitely damaged over time. So the purpose of the surgery really was to replace that valve with an artificial valve because my original one, my one that I was born with, was just not functioning correctly. And that caused the rest of my heart to enlarge as well, especially the right side, and pump harder and not work very well. So the main point of this was to replace that valve. Yeah, I was in the kind of the middle of doing all these tests, getting prepared for the surgery, and I had a date scheduled. My family was going to come out and stay in New York. We had an apartment set up to stay there for like a month as I recover. And I got a call from the doctor, and he said, there's a chance things might get delayed. So if you want to push up the surgery to tomorrow, I'm free, which was quite scary. I'm like, tomorrow? I'm not even ready, and my family's not even here. But I just felt like it was something I had to get done. That was my only goal. Get done, move on with life, get the healing process over with, because I have other things to do. So I said yes. And so the next day I went into the surgery very early in the morning. I went alone. I didn't have anybody with me. So that was kind of daunting. But it was just like, okay, I'm just ready to do this. The strangest feeling through this process was the day of the surgery, as I was getting ready to go into the OR. And I actually walked in the OR because first I was wheeled, which I thought first they knocked you out and then wheeled you into the OR. That's what I believed. But you're very conscious when you're going in there. And then, so I was in a wheelchair going into the OR. And then just before the doors, they're like, do you want to walk in or do you want us to wheel you in? And I was like, I guess I'll walk in. And so I did. I walked into the OR and saw the room, and it was actually quite terrifying. I remember seeing this table in the middle. It's where you lay down, and there are quite a few people in the room, and the walls are very empty, very white, and everything is just very clean. And I don't know, I just saw a lot of white and metal in the room, and that was it. But the doctors and the nurses around there, around the table, were very nice, and everything happened actually quite rapidly. I was, I guess, knocked out not too many moments after that, which is great because I definitely didn't want to be awake much longer in that room staring at everything. And then it's like a dream. You just go to sleep for a long time and hope that everything goes correctly. And then you wake up and the recovery starts, which is really the worst part, the recovery.
We'll come back to Jackie in a moment. For now, I want to go to Dr. Paris Shah, a fourth-year resident and graduate of Albany Medical College.
Could you describe what actually happens during an open heart surgery?
Sure. So, so basically, the surgeons make an incision down the mediastinum, so down the chest wall. They have to then access the actual heart chamber, so they have to crack the ribs open. After they do that, in order to access the heart, because the heart has 5 liters of blood going through it every minute, they have to put the patient on bypass. So that involves basically creating a conduit between the major veins and the major vessels in the body, such that you can open up the heart without blood just flooding in your face. At the same time, because blood isn't actually going through the body in a normal way, you have to decrease the metabolic demands of the body. So they lower the patient's temperature, and then after that, they use the most fine instruments that you can possibly think of with these microscopes loaded onto their goggles, and they make very fine cuts and open up the chamber of the heart. In our case, they opened up the right atrium, which is the chamber that accepts the major vessel, the major vein, the inferior vena cava. So they opened up the right atrium and they inspected it. And after they cleaned out, or they made sure that there was no tumor clot inside the atrium, using very, very fine sutures and very, very slight like flicks of the wrist. I mean, it's amazing how they did it. They have to close the chamber back up such that they don't really trigger much trauma to the tissue, because that can cause scarring on the heart. Then after they've closed the heart up, they have to warm the patient back up. So that can take up to an hour. I remember that taking an hour. I was just standing there. And then they have to get rid of that conduit, that bypass machine, and reconnect all of the circuitry. So blood, again, once is flowing through the heart, from the heart into the lungs, from the lungs into the left side of the heart, and then out to the rest of the body. So that's generally what they were doing.
Oh man, it's so intense. And do they actually, because when you say they crack the ribs open, are they actually sawing through the sternum? Are they, how are they doing that?
So the ribs connect to the sternum. There's like cartilage. So they have ththese clippers that can cut through the cartilage. It's not like a saw, but it's like these what I saw, and I'm, again, I don't use these, so I'm not certain, but it was clippers that they were using to clip through the costal cartilage. So it's not as hard as bone, but it's softer cartilage that the ribs insert into the sternum.
I just remember waking up and feeling like I was hit by a truck. I was in I guess the ICU with, tubes coming out of everywhere, my chest, my head, my I don't know, tubes everywhere. And it was definitely painful. Like, I do remember crying and going, okay, this is not fun.
Okay, so here's the thing that we have to share in your story here. That apartment where you stayed, it was not on the
Right.
ground level.
It was the fourth floor. And when I was booking it, the guy was like, you're going to have surgery. You probably don't want to book this apartment. And I was, oh, I can do it. And I was out of the hospital after 4 days, which was a pretty quick trip to the hospital and then out. And then it was around Christmas time too. So I just, I made it work. It was a very slow journey up those stairs, but I eventually got up there.
Yeah, but you did it on your own 2 feet. Nobody carried you. That's what's incredible
No,
about this to
yeah,
me.
no. Yep, walked on my own 2 feet, and then I stayed up there for a few days, and then I think we took a family trip to Macy's a couple days after that to look at the Christmas thing. So, I was still running around a week after the surgery. I was out and running about, well, maybe not running.
Yeah, maybe not running, but like mobile.
Now, what good is talking about the heart without spending some time on one of its greatest capacities? Love. Here's Dr. Pranay Sinha.
In residency, one of the biggest causes of grief is being single or being newly single. I've seen both those in my friends, and I was single for a while. And, not expecting anything at all, I sort of walked into this new rotation of mine, and I met Anne. And, I think you're so oppressed by sort of being an intern and like worried about sort of meeting expectations that you barely notice the fact that, your supervisor is this phenomenal person and, just a gorgeous woman to begin with. But, as time went on, I think, just seeing her interact with the patients was just really just mind-blowing. And so gradually I fell in love with the way she interacted with people, how kind she was. And as it happened, this was around Valentine's Day. So you could say I was a little bit seasonally affected. And I remember she was off on Valentine's Day, but on the 13th, she gave out all these Valentine's Day cards to our patients, and all the cards had small tattoos in them, like just those the ones that you stick on with water. And she wasn't there the following day on Valentine's Day, but her tattoos were there on all of my patients. And just sort of looking at those tattoos, I realized that I was feeling funny things for her. And then I think I waited with bated breath for the rotation to end. Within 2 hours of her supervisory yoke ending, I asked her out, and she said yes. And it's been just phenomenal. And I didn't think that was going to happen. There's that cliche of the boss and the pretty little intern. And I never thought I would be the intern in that cliche. But I literally stayed into that.
Well, that's terrific. Do you see each other very much in your day-to-day work?
You'd be surprised. Yeah, actually, we do manage to hang out quite a bit. It's one of the great things about being somebody in medicine is that they get it if on a night you can't make it or you're just too tired to hang out or if you're late, which we both of us consistently are late to our dates because we just get caught up. So, and that's kind of really just brilliant. And both my parents are actually also doctors, and I see how much of an advantage that is because when they have a bad day at work, they come home and they tell each other about it. And then the other person says, you know what, I think you did all you could. It actually means something because if there's somebody not in medicine, then it's kind of harder to, even if they're trying to be nice to you, you're like, no, I know you're trying to be nice, but I don't think I did. But, but when a fellow physician says that to you, you say, okay, well, I'm glad that another professional colleague who I clearly respect feels the same way. And so that is pretty cool.
That must be a salve to any sort of gaping wounds from many, harder cases and things of that nature, no?
It is. And I'll also tell you, it's kind of nerdy, but I think Anne and I often sit down and do any JM cases together. It's a clinical medical cases together, and it's actually incredibly fun to do that with the person dating. And then right after that, we often read poetry. So it's kind of like being able to share kind of your entire self with somebody, not just sort of one side or the other. And that's kind of really cool.
Yeah, I think what's scary about having a heart condition is you're always kind of reminded, because the heart is an organ you can feel and you can hear it. And mine definitely has a funny beat. It always had a funny beat before my recent surgery. And then once the surgery was complete, it definitely has a better sound. It sounds like it functions a little better, but there are definitely rhythms that are off or skipped, rapid, and it's constant. So it's a constant reminder that this condition is with me forever. But, all I can do is just either drown it out with music at night or just keep busy during the day. And tonight, I try not to do anything that would put it at risk, like smoking or doing drugs or, I don't know, whatever, skydiving. It matters to take care of what you have and love it. Love it in a weird way. That sounds strange to love it, but that's all you really can do. I think maybe it's also a good reminder because I know that I was actually an orphan in a country far away called Vietnam. And I was in an orphanage with other sick babies, but there were doctors walking through and looking at the different children. And there was one doctor there, and she had spotted me and said, "No, there's something different about this baby. She has a heart condition. I can tell." They could probably tell from like the cyanosis, the blue fingers and blue lips, because that's a common symptom of the condition that I had, tetralogy. So just because of that timing, that meeting right there, I was one of the only babies that got out of that orphanage and came to America to have the surgery, and that just kind of triggered the rest of my life. And that doctor that spotted me had the same condition as me as well. So I think that probably kind of sparked something in her. I don't know. I've obviously never met her again, so I don't know where she is, but I always think about her. So I guess sometimes my heart, it still kind of haunts me, and the beat of it and the sound and the rhythm, but it definitely is a reminder as well where I've come from or how far I've come.
Personally, I've come to believe that in life, true strength lies in remaining flexible, vulnerable, and soft, not unlike the heart. What's more, after the interviews for this episode, I found myself, yet again, in awe of the heart, its simple efficiency in complex problems, its role as the iconic home of our emotions, and the brave physicians who seek to repair it. Rainer Maria Rilke once wrote, "For one human being to love another, that is perhaps the most difficult of all our tasks. The ultimate, the last test and proof, the work for which all other work is but preparation. And for me, the work doctors do, that urge to heal one another, is one of the greatest expressions of love." And speaking of expressions of love, it looks like those temporary tattoos had a permanent effect on Pranay. Congratulations. Thank you to Drs. Shah and Pranay Sinha. And a very special thank you to Jacqueline Jackman, the My First Cadaver team, Papa Claire Music at Compulsion Music, our Nerf blasting friends at Salted Stone, and special thanks to Robert Meekins, who is not a doctor. And P.S., happy belated Valentine's Day. We wanted to share this episode a bit earlier, but alas, real life happens. And remember, guys, don't bring your laptop into the bathtub with you for your browsing pleasure, or you could become someone's first cadaver. How do two doctors get engaged? Check out our blog for the next chapter of Pranay's love story. That's blogmfc.com.